Hi, my name is Karen Wonders. I'm the founder and CEO of Maple Tree Cancer Alliance and Maple Tree Education. And for this week's webinar series, we are going to look at how you, as an exercise professional, can develop your clinical skills. This is a very important conversation to have, especially as exercise is now moving into standard of care for medicine across all different kinds of disease states. Us as exercise professionals now have a seat at the table with these interdisciplinary clinical teams. And so we need to understand what our role is at this table that we're sitting at and how we can develop our skills so that we can provide the very best possible care to the patients that we serve. So I'm going to share my screen and walk us through this presentation today. So today in our conversation, we are going to look at the role that clinical skills play, basically as this lays a foundation for successful practice in exercise oncology. We're also going to look at the different key health professionals that are at the table in this multidisciplinary clinical team, what their roles are, and the various clinical settings that particularly exercise oncology can take place in. We're going to take a look at documentation and the EMR and the different data that needs to go into place there. And then finally, tips and strategies for you on how you can build your clinical skills. So, to begin, the foundation here of exercise oncology practice is the importance of building your clinical skills in exercise oncology. Exercise oncology really sits at this critical intersection right now between exercise science and cancer care. And as this field continues to grow very rapidly and gain momentum all the way across the world, the demand for well-trained professionals who can safely and effectively guide cancer patients through exercise interventions it's never been higher. Clinical skills are going to form the foundation for successful practice in exercise oncology for several reasons. The first one is that cancer patients represent a unique population and they have specific needs and specific considerations. You have the disease itself, and then you have the various treatments like chemotherapy, radiation, surgery. All of these are going to create physiological and psychological complexities that require a specialized knowledge and adaptable intervention strategies. The second thing is that effective exercise prescription in exercise oncology is going to demand a nuanced understanding of risk assessment and symptom management. You have to be able to recognize when exercises may exacerbate symptoms versus when exercise can alleviate symptoms. And this clinical judgment can only be developed through dedicated training and practical experience. Third, exercise oncology professionals rarely work in isolation. You are going to be a part of a multidisciplinary team, and you're going to work alongside of oncologists, nurses, physical therapists, and other healthcare providers. And so strong clinical skills will enable you to communicate effectively with these colleagues, understand medical terminology, and finally integrate your work into broader treatment plans. And finally, building trust with patients facing life-altering diagnoses is going to require exceptional interpersonal abilities. Your clinical approach must blend technical expertise with compassion, with creating a safe environment where patients feel understood and supported in their exercise journey. So throughout this webinar today, we are going to explore how to develop these crucial clinical competencies that will distinguish you as an exercise oncology professional and ultimately improve outcomes for the patients that you serve. Right here, we are going to look at the clinical environment. If you're going to understand the clinical environment, then you need to understand the medical oncology team and who all is going to be a part of this medical oncology team. So we've got medical oncologists, we have oncology nurses, and we have oncology pharmacists. So let's look over each one of these in a little bit more detail. When it comes to the medical oncologists are physicians who specialize in treating cancer with systemic therapies such as chemotherapy, immunotherapy, and targeted therapies. They often serve as the primary coordinator of the patient's care for cancer. So imagine them as like the quarterbacks of this team right here. Then we have oncology nurses who are specialized nurses who can administer treatments. They can monitor patients while they're receiving therapy. They can help patients to manage their symptoms, and they provide crucial education and emotional support to the patients. And then finally, oncology pharmacists. These are experts who prepare and dispense cancer medications while monitoring for potential drug interactions and side effects. So next we have the radiation oncology team. The radiation oncology team is going to consist of the radiation oncologist. It also consists of radiation therapists and medical dosimetrists. A radiation oncologist are physicians who treat cancer using radiation therapy, just as it sounds. Radiation therapists are professionals who operate the radiation equipment and position patients for treatment. And then finally, the medical dosimetrists are specialists who calculate and plan the precise radiation doses that the patient will receive. When it comes to the surgical team, we have surgical oncologists and reconstructive surgeons. So surgical oncologists are the surgeons who specialize in removing those cancerous tumors and the affected tissues. The reconstructive surgeons are going to be specialists who help restore function and appearance after a surgery. When it comes to supportive care specialists, we have oncology social workers. Oncology social workers are professionals who help patients to navigate practical challenges, anything financial, anything logistical, and they also provide psychosocial support for the patient. We have psycho-oncologists who are mental health professionals who specialize in addressing the psychological aspects of cancer. We have dietitians who are experts in nutrition who help manage cancer-related nutritional challenges and side effects. We have physical therapists who are specialists who address physical impairments, mobility issues, and lymphedema management. Next is occupational therapists who are professionals who help patients to maintain their activities of daily living and their independence while they're undergoing cancer treatment. And then finally, we have pain management specialists who are clinicians who are focused on controlling cancer-related pain and discomfort. Next, we have specialized care coordinators for cancer patients, and these include nurse navigators, who are specialized nurses who guide patients through the complex healthcare system. They help the patients to coordinate appointments, and they are going to serve as the patient's primary point of contact. The tumor board coordinators then are going to be professionals who organize multidisciplinary tumor board meetings where complex cancer cases are discussed. So, given the whole of the multidisciplinary cancer team, it's important for you as the exercise professional to understand where the exercise oncology instructor is going to fit. And as an exercise oncology professional, you are going to coordinate and collaborate with many of these specialists. So some of the ways in which you're going to integrate with these specialists are you're going to receive referrals from oncologists. You are going to coordinate with physical therapists on functional limitations. You're going to communicate with nurses about symptom management for the patients. You can potentially collaborate with dietitians on energy balance strategies. And then it's very possible that you would work with psycho-oncology in terms of providing adherence and motivation to the patient. So you can see this is a very well-rounded team, and it's important to understand which individual you can work with for different factors. There's going to be different reasons that you're going to work with different people. Helping you to understand each team member's scope of practice, terminology, and workflow will help you to communicate effectively using appropriate medical language. It will help you to recognize when to refer patients back to their clinical teams. It'll help with the timing of exercise interventions appropriately with regard to their treatment schedules. And you can help to contribute meaningful information to the overall cancer care plan. And then finally, your role as an exercise professional is really to advocate for exercise to serve as a standard component of that cancer care plan. So developing relationships with these professionals and demonstrating how exercise will help them to support their clinical objectives will help to establish you as a valuable member of the cancer care team. Ultimately, this is going to enhance patient outcomes, and it will provide a truly integrative care plan for those patients, which is the ultimate goal when it comes to clinically based exercise oncology. So, in terms of the clinical settings, what I want to do in this section is to look at the different types of settings where exercise oncology can take place in. In general, we have hospital based programs, we have outpatient clinical settings, and we have community based programs. At Mapletree, we have all three of these different settings within different partnerships that we have across the country. And each one is just a little bit unique when you compare them one to the next. And so I want to go through the nuances and the type of patient population and kind of the type of setting each one of these will provide for you. When it comes to hospital based programs, generally the physical environment is going to be integrated within the cancer centers or on dedicated oncology floors. Oftentimes, it is a conference room that's dedicated to the exercise space a couple of days per week. Sometimes you have dedicated gym space right down the hall from the infusion therapy room or radiation room. It's going to look different depending on the hospital and what their space availability is and where you're able to fit in. So I think the important thing here is to remember just to be flexible and try to do your best to work within whatever constraints that you have. If there truly is no space available, then virtual training telehealth options are always going to be a great options to still continue to serve patients. When it comes to clinical integration, you ideally will have direct access to oncology medical records and treatment plans. You are very possibly going to have frequent interaction with the medical team. This includes oncologists and nurses. Typically, you're going to see a higher level of clinical credentials and understanding of medical procedures, and there's going to be a greater opportunity for interdisciplinary collaboration. In general, the patient population, you're going to see a higher portion of patients in active treatment. There's going to be a greater likelihood of encountering some medically complex cases. So that could be more advanced illnesses, people that have cancer and other comorbidities that are coexisting. You're going to probably run into a little bit more complex cases like that. And generally, these patients are going to have a higher acuity and symptom burden. So that will need to be taken into consideration with the exercise intervention that you design. In terms of program structures, typically you're going to need a physician referral when it comes to structuring the exercise program. And generally, there's going to be more formalized documentation requirements because of the setting that you're in. You also want to have stricter adherence to clinical guidelines and protocols as you're designing the exercise programs. And in terms of professional implications, as the exercise oncology professional, expect that you may practice across all of these settings that we're talking about throughout your career and understand that hospital settings demand stronger clinical assessment skills, more medical knowledge, and the ability to work within a healthcare system. When it comes to outpatient clinical settings, generally the physical environment is going to be dedicated rehab space or a standalone clinic that is strictly for rehab purposes. And ideally, you would integrate in with that. So you may be working right alongside a physical therapist, occupational therapist. We have some settings where we will work alongside of the cardiac rehab team. It's important here that you'll see a balance of clinical and wellness oriented equipment, and medical support is likely going to be available but less immediate to you than you would have in a hospital-based setting. Because of this, it is a more flexible space design with more focus on functional exercise. In terms of the patient population, really, I think you're going to see a mix of different people. You're going to probably have some patients that are in active treatment and some patients that are post treatment. You're also probably going to see varying levels of medical complexity. Oftentimes, you might have patients that are transitioning from the hospital into home based routines. And oftentimes, these patients are going to have a wide range of functional capabilities. So, therefore, your program structure should be very structured progression protocols, very defined endpoints, and you can here balance individualized exercise programming with group exercise programming as it becomes available. In terms of professional implications, outpatient settings oftentimes do require adaptability. and the ability to bridge clinical and fitness paradigms. And that's because you're going to have different individuals who have different. And then finally, when it comes to community based exercise programs, oftentimes this is going to include things like the YMCAs, fitness centers, community centers, dedicated survivorship facilities. Oftentimes, here, there's going to be a greater emphasis on conventional fitness equipment, and it's going to be much less clinical in appearance and more wellness oriented. Oftentimes, you're going to have more limited medical support systems. And in terms of clinical integration, you still want to provide communication with medical providers. This will primarily happen through referral forms and progress reports that you're sending to the medical team. But there is going to be a greater responsibility on the exercise professional to recognize when medical consultation is needed. Oftentimes, you're going to see less of a direct access to medical records and treatment details. So, you're going to need to obtain that information from the patient. And there's going to be more of a focus on general fitness with some cancer specific adaptations, keeping in mind that oftentimes, even when clinical active treatment has ended, patients are still going to be experiencing the long term and late effects of cancer treatment for a long time. In terms of the patient population, oftentimes you're going to see a mix of patients who are in active treatment, but primarily in the post-treatment phase. And generally, there's going to be a little bit more stable medical conditions, more long-term engagement of the patients. Ideally, you want them to stay active for the rest of their life. And so there is going to be more of an emphasis on quality of life and returning to normal activities so that they can maintain their functional independence as long as possible. Oftentimes, program structure is going to focus on peer support and community building, and it's generally going to require less intensive documentation requirements. In terms of professional implications for the exercise professional, community settings oftentimes emphasize program development, group facilitation, and creative problem solving with limited resources. And so, trying to be creative as you approach these patients and enable them to have long term wellness and independence. The next part in building your clinical skills includes things like documentation and electronic health records. The critical role of documentation in exercise oncology is very important because documentation is a fundamental aspect of clinical practice in exercise oncology, and it serves multiple essential functions. As an exercise oncology professional, your documentation practices are going to directly impact your patient care, your program evaluation, communication with the healthcare team, and legal protection should it come to that. Some core documentation components that you really want to be sure that you're documenting as the patient moves through your program are going to include the initial assessment documentation. This should have a comprehensive health history from the patient with a special focus on cancer diagnoses, cancer treatments, and cancer complications that arise, any baseline physical assessments that you measure. So this would include things like the cardiovascular assessment, muscular strength, muscular endurance, range of motion, and functional capacity of that patient. You also want to include a cancer specific symptom inventory, such as things like fatigue, pain, neuropathy, lymphedema, any psychosocial aspects that could potentially impact exercise participation should be measured. A risk stratification and contraindications to exercise should be documented. And then individualized exercise program goals that align with the patient priorities. All of that should be included in that initial assessment documentation. Next, we move on to the exercise prescription. And this should include things such as detailed fit parameters. Remember, fit stands for frequency, intensity, time, and type of exercise. Any exercise modifications that are specific to the cancer type, cancer treatment, and side effects. Any precautions related to surgical sites, medical devices, or compromised tissues, any equipment adaptations or accessibility accommodations that the patient may have. And then finally, exercise progression timelines with objective milestones should be documented as well. In terms of session documentation, you want to be sure that you're tracking attendance and program adherence so that you can report those numbers back to the care team. You want to be sure that you're reporting any acute responses to exercise, such as vital signs, RPE, changes in symptoms. You want to write down things such as exercise tolerance and completion levels, any modifications that you had made during the exercise sessions, as well as rationales as to why you made those modifications to the exercises, any adverse effects that may have happened or concerning symptoms that may have happened during the exercise program. And then finally, any patient reported feedback and experiences that patient noticed. When it comes to the electronic health system records, there are different platforms that are going to be used in oncology. So one health center may use a different health center than another one. And so it's good just to be familiar with that it can change as you go from one health system to the next. And it would probably be important for you to familiarize yourself with whatever electronic health system they do use at the current health system that you're working with. Some of the more common EHR platforms that we see in oncology include Epic. I would say probably 90% of the healthcare teams that we work with do utilize Epic. Also, sometimes you may see Cerner, Mosaic, Allscripts, eClinicalWorks, and then sometimes you see specialized rehab documentation systems such as TheraOffice. Again, this is going to vary from one health system to the next. And when you're navigating the electronic health information, the things that are going to be pertaining to you as the exercise professional include things like any relevant oncology treatment information. You want to know what they're being treated for, how they're being treated, and what their schedule is, because that will allow you to tailor your exercise program and the timing of that exercise intervention around those things. And it will also help you to be aware of what side effects you can expect from the patient to most likely experience. You also want to take a look at laboratory values and medication lists. Oftentimes, medications are going to impact the exercise response. So it's really important for you to know what medications they're taking and what the potential side effects are of those medications so that you can be aware of them when you're exercising with those patients. Any secure messaging with the oncology team members should be done through the EHR. You can flag critical information for physician review. You can contribute to the patient's shared care plan, and you can help to track referrals and consultation requests all here in the EHR. And so that's one document where everyone on the care team is going to have access to. And it's a great way to communicate with each other. In terms of documentation standards and compliance, one of the most common ways that you see documentation take place it is with something called SOAP notes. And SOAP notes is commonly used in clinical language. And so I do want to explain to you, the exercise professional, what SOAP notes are, because oftentimes this is not covered in our undergraduate exercise science curriculum. So you want to make sure you're familiar with these terms. SOAP notes stand for, the S stands for subjective, O is objective, A is assessment, and P is plan. So what do those mean? Subjective means what are the patient reported symptoms, concerns, and experiences that they're having. Objective then are going to be measurable assessment findings and exercise metrics. In terms of the assessment, this will be the clinical interpretation of the findings and of the exercise response. And then finally, P, the plan, is the adjusted exercise prescription and any follow up recommendations that are a part of the exercise program. So if you document in this manner, you're going to be following the clinical care plan in the way that the rest of the clinical team is going to be reporting on their specialized things. With cancer specific documentation requirements, it's important that you document the oncologist clearance for exercise. You want to make sure that you're tracking cancer specific treatment schedules and timing of the treatments, as well as timing of the exercise program. You can use this to monitor treatment specific precautions, such as neutropenia being present with the patient, and then recording any relevant cancer biomarkers when available. The next thing that you oftentimes will hear about is HIPAA. HIPAA fundamentals. Basically, what HIPAA is a federal law that protects patient health information. So, why this matters, first of all, this applies to anyone who works in the healthcare setting. So, it does include the exercise oncology professional and exercise oncology programs. Whenever Mapletree contracts with a new healthcare team or a new health center, we do have to provide evidence that all of our data collection systems are HIPAA compliant, and we need to keep that at the forefront of any conversations that we're having. Violations of HIPAA can result in up to $50,000 worth of fines per incident and also potential criminal charges. So it is very important that you are aware of HIPAA rules and you take steps to guard yourself and make sure that you are compliant with these HIPAA laws. This is important not only legally, but also because of patient trust. You're trying to build your patient trust. And cancer patients are especially vulnerable and deserve privacy protection. So you want to make sure that you, as the clinical exercise professional, are adhering to these legal and ethical obligations. When it comes to protected health information for an exercise oncology professional, the following constitutes protective health information. So these are informations that are under the rules of HIPAA that you want to keep private. This includes things like the cancer diagnosis. This is the type of cancer, the stage of cancer, any genetic markers that are present, and any pathology results that are present. This also includes treatment details, the surgery type, chemotherapy agents, radiation dosing, all of that is included under HIPAA. Any assessment results, so fitness tests, body composition, symptom scales, all of that is included in HIPAA. Exercise prescriptions that reflect clinical limitations. And then finally, progress notes that detailed treatment responses are all going to be the protected health information that is under HIPAA. When it comes to common exercise oncology documents, this is going to include things such as exercise training logs, treatment schedules, symptom monitoring sheets, any pictures or videos. You want to make sure that you're obtaining consent for that, and then communication logs with the oncology care team. Some practical guidelines that you can follow as the exercise professional include physical environment considerations, electronic safeguards, and different safeguards that you can follow. In terms of physical environment considerations, you want to be sure that you're conducting assessments in a private place, not in an open gym floor. You want to make sure that the exercise areas are not really present and visible so that anyone can walk in. And you want to make sure that the clinical documentation is kept private, that you have secure filing systems with locks for paper records, that the computer screens that you have are positioned away from public view, and that you have sign-in information that does not reveal diagnosis information. Different electronic safeguards that you can follow include things like having password protection that can be changed regularly. Oftentimes, having two-factor authentication is important. Encrypted file sharing rather than a standard email. Mobile device security, such as passcodes, and making sure that you're not keeping any PHI on personal devices without institutional approval. And then finally, when it comes to communication practices, this includes things like discussing patients in elevators, cafeterias, or gym floors. You want to stay away from that altogether. Any group session privacy protocols, don't discuss conditions when you're working in groups settings. You want to make sure that you have written consent from the patient before sharing information with any caregivers. You want to use secure messaging platforms rather than standard texting. You want to de-identify any information when you're consulting with colleagues on a particular patient case, and always be aware of voice levels during phone conversations so that because you just never know who's listening. So those are all steps that you can take to make sure that you as the clinical exercise professional are adhering to HIPAA guidelines. The last part of this that I want to do is just go through different functional assessments with regard to different cancer types. This is a much, much deeper conversation that we can have on a later date, but it's important to understand that if you're looking at the clinical population that you're going to be working with, These are going to be individuals who are in active cancer treatment. And sometimes, depending on the type of tumor that they have and the type of treatment that they're undergoing for that particular tumor, you're going to need to make changes in your functional assessments. And so I just want to start the conversation here, but keep in mind this is a part of a much greater conversation that we can have as this webinar series progresses. Oftentimes, cancer specific functional assessments are going to require these tailored approaches based on the disease site, the treatment effects, and individual patient status. I want to look at the four most common tumor types that we have here in the States. That includes breast cancer, colon cancer, prostate cancer, and lung cancer. So, when it comes to breast cancer, one of the things that you want to be the most aware of is upper extremity function. Oftentimes, breast cancer patients are going to have surgery, either a lumpectomy or a mastectomy, a sentinel node biopsy. All of these are going to impact the upper extremity function in a negative way. And so, some of the things that you want to do as the exercise professional when you're assessing upper extremity function are things like the goniometer, and you can measure shoulder range of motion. You can do grip strength dynamometry to assess overall upper body strength, upper body extremity index for any activity limitations that are present. You can do circumference measurements to measure for lymphedema and postural assessments that focus on scapular positioning and any thoracic kyphosis that could be present. Those are all things that you're going to want to be accounting for when you're working with a breast cancer survivor. In terms of surgical considerations, you want to make sure that you're evaluating the incision sites for healing, for sensitivity, and any movement restrictions that might be present. You want to assess tissue mobility at the site of the surgery, whether it's a mastectomy or a lumpectomy or reconstruction surgery sites. And then also functional reach test with the consideration of any implants that are present or tissue flap restrictions. So keeping all of that in mind as you're assessing the patients. When it comes to working with individuals who are undergoing treatment for prostate cancer, the two things that you really want to be aware of here are pelvic floor function. Oftentimes, you're going to see this be negatively impacted with prostate cancer and the different treatments that are involved. So, validated questionnaires for urinary continence assessment, any functional test assessing body positions that challenge continence, and then core strength and stability testing with a very deep focus on abdominal activation is going to be important here. The next thing you want to keep in consideration is the bone health consideration. So, looking at the fracture risk scores, this is particularly important for patients who are on androgen deprivation therapy, where they often see a decrease in their bone health and a much higher risk for fracture. You want to be sure that you're performing balance assessments using validated tools such as the Berg balance scale and the timed get up and go test. And then finally, fall risk screening, including things like proprioception and vestibular function tests, are going to be important with a prostate cancer population. When working with lung cancer patients, you can perform the cardiopulmonary assessment. This could include things like the 6-minute walk test, modified Bruce test, and with close vital sign observation, any spirometry testing, such as FEV sub 1 or forced vital capacity, would be important. Respiratory muscle strength testing, such as maximal inspiration and expiration pressure, and then dyspnea scale. So the modified Borg test would be used during rest and during activity. You also want to take into consideration the chest wall mobility of this patient, the thoracic expansion measurements at different multiple levels, and assessment of surgical sites, restrictions after a lobectomy or a pneumonectomy, and then postural evaluations focusing on compensatory patterns are going to be important. Finally, when it comes to colorectal cancer patients, you want to pay close attention to core and abdominal function of the patient. So, assessing abdominal wall integrity post surgery is going to be very important. Evaluating stoma site considerations and restrictions, any core endurance testing with modifications for surgical precautions, and multi directional reach tests for functional stability is important. Sometimes you want to take into consideration the lower extremity function as well. And this is going to include things such as the balance assessment, particularly looking at peripheral neuropathy and the presence of that. Any heel to toe walking for proprioception evaluation is going to be really important. And then sit to stand tests can be used to evaluate lower body strength and function. After you've done that initial assessment, then you also want to look at the exercise prescription and any modifications that should be present to adapt for different treatment related side effects. These can include modifications for chemotherapy, such as neutropenia. With neutropenia, what you want to do is avoid crowded exercise equipments. You want to emphasize proper equipment cleaning protocols, emphasize home based or individual sessions, especially during vulnerable periods where their immune function is going to be lower, and monitor for infections during the exercise bout. Patients that have thrombocythemia as part of their chemotherapy treatment, you want to modify resistance training to avoid the Valsalva maneuver. You want to decrease the impact and collision risk that could be present in exercise selection. You want to use the RPE based intensity scale rather than the percentage of max. And then finally, you want to avoid any exercise that could potentially cause bruising. For patients who have peripheral neuropathy, you want to try to aim for increased stability support during standing exercises. So you can use chairs or rails that'll help with the balance of the individual. You want to make sure that you're modifying the foot position to provide a good base of support while they're exercising. Select closed chain exercises over open chain exercises when the balance is compromised. You might want to consider pool-based exercises for individuals that have severe neuropathy if this is available to you, and then also provide visual cues when proprioception is impacted. For patients who are experiencing cardiotoxicity as a result of their chemotherapy agents, you want to implement longer warm up and cool down periods. You want to monitor their heart rate recovery during intervals. You can use RPE alongside of heart rate monitoring. You want to make sure that you're doing progressive intensity increases with cardiac monitoring. And then finally, consider non traditional cardiac modalities such as arm ergometry and seated steppers as just a lower impact option. And then finally, with cancer related fatigue, this is the most common chemotherapy side effect that we see. And so, when you're dealing with someone who has cancer related fatigue, you do want to try to time sessions to energy peaks throughout the day. And you can implement energy conservation techniques between exercises and use an interval approach to exercise rather than continuous activity to help guard their energy levels. You may want to consider shorter, more frequent bouts of exercise as opposed to one long duration. And then any balance or strengthening or aerobics component should be based on the fatigue pattern that the individual has. So remember, you want to try to stay as flexible as you can and accommodating to that patient. You want to meet them where they are and adjust the exercise program accordingly. When it comes to radiation specific contraindications and considerations, oftentimes with radiation, patients who have skin reactions. So you want to do your best to avoid chlorinated pools during active treatment because this could exacerbate the skin reaction. You want to try to eliminate friction at radiation sites. So this may require you to modify equipment as they're going through the program. You can select clothing or have the patient select clothing that's going to prevent this irritation from developing and adjust the resistant equipment to avoid direct contact with the impacted skin if you're able to do that. Some site specific modifications, and this what this means here is where is that radiation being directed and how can you take in some modifications into account when you are working with someone who's receiving radiation to this particular area of the body. So when you're working with an individual who's undergoing brain radiation, you want to be careful to monitor for dizziness, any cognitive changes that are present, and then seizure activity. With patients who are receiving radiation therapy to the chest wall, you can gradually progress thoracic mobility with respect to tissue tolerance. For pelvic radiation, pelvic floor radiation oftentimes can be very painful for that patient. And so you want to be sure that you're modifying positions of exercise that are going to increase pelvic pressure or lead to discomfort. You want to try to stay away from those. And then finally, patients who are receiving radiation to bone, you want to be sure to decrease the impact and any forces that are present at irradiated bone sites. In terms of surgical considerations, timing is going to be very important. You really want to take an effort to respect tissue healing timeframes. So traditionally, this is going to include about 6 to 8 weeks for initial healing to take place. And you want to follow surgeon specific protocols for movement restrictions. You want to progressively reintroduce range of motion and then resistance training once you have range of motion established. And then finally, make sure that you're monitoring incision sites for healing complications during the exercise programs. So, some site specific approaches you can take for individuals who have had surgery to the breast area. You want to make sure that progressive shoulder mobility protocols are followed. You want to do a gradual loading of the chest wall musculature as the patient is able to tolerate. You want to monitor for scar tissue mobilization integrations and then any postural correction emphasis. You want to make sure that you're emphasizing that. When you're working with patients who have had abdominal surgery, such as for colorectal cancer treatment, it's important that you use core activation without increasing the intra-abdominal pressure of that individual. You want to make sure, again, that you are taking considerations for positioning with a stoma. You want to make sure that you have a progressive return to any rotational movements, and then make sure that individual has proper support for any ostomies or appliances that are utilized during exercise. For patients who have had thoracic surgery, breathing coordination with movement is going to be very important. So, reminding the patients inhale on the way up, exhale on the way down, making sure they're not holding their breath. That's going to be very important. You want to follow gradual progression of arm elevation with pain monitoring, have careful positioning to avoid pressure on the incision sites, and modified positionings for comfort during floor exercises. Anytime you're working with an individual that has a medical device, there are exercise accommodations that you want to be making sure you're aware of. The first one is when you're working with an individual that has a port, you want to avoid the submerging that port in water unless it's properly protected. You also want to modify chest exercise to avoid direct pressure on that port site, eliminate resistance band placement across that device, and then adjust the heart rate monitor placement if it's conflicting. So if you have like a chest monitor to monitor for heart rate, you want to make sure that it's not positioned over the port. For individuals who have feeding tubes, yes, these individuals can exercise, but you want to make sure that you're securing that feeding tube during movement and you modify any prone positioning or any type of exercise that can have direct pressure on the abdominal wall. You want to make sure that you're avoiding that altogether. Be sure to consider timing of the exercise program relative to the feedings that the individual is undergoing and avoid exercise that's going to cause pressure changes at the insertion site of the feeding tube. For patients who have ostotomies, you want to time the exercise around appliance changes. You want to modify core exercise to avoid excessive intra-abdominal pressure. You want to provide for privacy for bag emptying if that's necessary during longer sessions of exercise, and potentially consider compression garments for high impact activities. And then finally, for any implanted devices, make sure that you're following specific guidelines for things like pacemakers or defibrillators that are present. Avoid direct mechanical stress on implanted ports. Consider electromagnetic interferences with some potential devices that are present. And make sure that you're modifying resistance training for grip for dialysis. Some red flags to take into consideration when you're working in a clinical setting with exercise are you want to be aware of any immediate exercise cessation indicators. These would include things like chest pain or chest pressure, unusual shortness of breath that's not proportional to the exercise exertion, any dizziness or lightheadedness that's not resolved with rest, any new onset of irregular heartbeat or heart palpitations, and any severe nausea or vomiting that occurs during exercise. You want to immediately cease the exercise program at that point. Post session monitoring, you want to monitor for excessive fatigue that lasts beyond 24 hours after that bout of exercise. You want to look for any new or increased swelling in the extremities, any unusual pain that is not consistent with a normal exercise response, any development of fever following the exercise session, and any potential increased bruising or bleeding following that exercise session. With chemotherapy timing, you want to make sure that high intensity exercise is not engaged in the 24 to 48 hours following treatment. This is oftentimes going to be contraindicated for that patient. You want to be sure to assess symptoms before determining the appropriate intensity of the exercise program. You want to monitor for hydration status after, especially the platinum based treatments, because that can lead to dehydration, and recognize the cumulative effects of chemotherapy as the chemotherapy dose increases. So, recognizes that as you go through later treatment cycles, oftentimes the symptom severity is going to be amped up. So, be ready to adjust for that. And then finally, radiation considerations. When you're working with someone who's undergoing radiation, you really want to try to time exercise relative to the energy patterns during the treatment course. Fatigue is going to be a main side effect that patients who are undergoing radiation will experience. And so, really try to maximize when fatigue is at the lowest. That's when you want to try to engage the patient in exercise. You want to make sure to modify during peak skin reaction periods, any special considerations during brachytherapy interventions, and then just having an awareness of cardiac strain with left sided breast radiation in particular as you're going through the exercise program. Now, I realize that might feel like an overwhelming amount of information. And so, what I would recommend is go through this nice and slow, take notes as you're going through, but then understand that there are things beyond this webinar series that you can do to build your own clinical skill set. And so, there are educational pathways that are available. In fact, I am a professor and program director at Wright State University in Dayton, Ohio, where we just started an exercise oncology certificate program. This is an online program that can be available to undergraduate exercise science students or graduate exercise science students. You don't even have to be enrolled at the university to sign up for the exercise oncology certificate program. We have people all over the US that are taking this program because it is entirely online. So that is one option you can do to build your clinical skill set. You can also get a specialized certification. So at Mapletree, we provide the exercise oncology certification. This is recognized as a gold standard in certification, and it focuses specifically on cancer and exercise and when someone is undergoing active cancer treatment, and teaches you how to modify your exercise program accordingly. Some clinical observation hours and internship opportunities. We have them available through Mapletree. And if you want to go to your own local hospital and see if they have an exercise oncology program where you can just observe or potentially intern at, I would recommend doing that as well. You can do formalized internship programs, which are going to be dedicated cancer exercise programs and student in places that accept student interns. For that, you want to be very aware of application timelines and that it could potentially be a competitive selection process, especially as this need for a qualified and skilled workforce grows. You want to make sure that you're keeping yourself competitive with the other applicants and make sure that you are holding yourself accountable and responsible to build your clinical independence so that when you present yourself as an intern or a volunteer or as a potential employee in this clinical setting, that you have a good clinical skill set. You can also participate as a research coordinator or in any research experiences that are possible. It's really important, I believe, that exercise oncology research is translated to exercise leaders. So what that basically means is the work that we're doing in research to establish evidence-based protocols, to establish the most effective ways of implementing programs, that gets translated to the people who are actually practitioners in this field. And so you can play a role in that. You can, with research, you can help to understand protocol development and implementation guidelines and helping to learn standardized assessment techniques that are going to be used in research. In terms of volunteering and participating in cancer centers, what I would recommend is go to your local cancer center. And even if they don't have an exercise oncology program, you can just volunteer as whatever need that they have available. But that will help you to meet the medical team. It'll help you to start to understand how they work, what the flow is, what the language is. And that will really help you to establish your own clinical skill set. In terms of job shadowing, what I would recommend is identify mentorship opportunities. So connect with an established exercise oncology professional. You can attend professional conferences. We are in the process of developing the International Society of Exercise Oncology. We are having an annual meeting in Germany next year, 2026. So I would recommend attending that. But if you're unable to attend that because it is in Germany, if travel is an issue, you can always come to the ACSM conferences and go to the exercise oncology presentations and research that is available and get to know those people and ask if they can mentor you as you look to try to grow your skill set. You can also, if you want to maximize your shadowing experiences, what I would recommend is prepare questions ahead of time. Request a debrief after patient interactions. Don't be afraid after the session is done to ask the exercise professional, why did you modify it this way? What do you do if this was present? How do you know what to do with this particular situation? And then follow the patient cases across the treatment continuum if possible. So I got my start in clinical exercise physiology and cardiac rehab. And when I did my internship in cardiac rehab, I had the very unique but awesome opportunity to observe a patient getting open heart surgery. They got a quintuple bypass. And then I was able to follow that particular patient all the way through all the phases of cardiac rehab. So I saw them in surgery, I saw them immediately post surgery, and then through all of the different phases as they regained their functional independence. That was such a valuable experience for me because you see someone in a later phase of treatments or as they're completing treatment, and it's hard to understand what they had just gone through. It can be really hard in that situation to put yourself in that patient's shoes. Being able to follow the patient all the way through a patient experience will allow you to really understand where that patient is and meet them where they are. The and then just in conclusion, when it comes to your journey with exercise oncology, keep in mind there is a growing need for professionals in this field. And if you have watched this far, you've made it this far in the webinar, then I believe that you do have what it takes and you do have the interest that is there. And just take steps to build your skill set in the clinical setting, and understand that there is a gap that exists between patient needs and qualified health professionals. And as career opportunities become available, as mentorship opportunities become available, make sure that you're really trying to take advantage of these and understand that your own unique contribution to this field, exercise specialists can improve patient outcomes. We are really helping to change lives for the better. So you have an important role to play as the exercise professional. Don't discount what you do and don't discount the impact that you can have on a patient when you're working with them. It is a challenging job, and I'm sure there have been times, even today with this webinar, where you have felt a little overwhelmed. But what I would say is that the rewards far outweigh the challenges. And so just keep going, keep pressing. In terms of next steps, there are some concrete actions that you can take today if you want. What I would recommend you do is join professional organizations such as ACSM or the ISCO, the International Society of Exercise Oncology that we are establishing. Connect with oncology departments at different clinical settings around you. Identify any local cancer wellness programs in your community. If there are no cancer wellness programs in your community, contact me. I can help get a maple tree established there. Start following key researchers in this field. Katie Schmitz is a great one that I would recommend following, and engage with them on professional platforms. And make sure that you access recommended introductory resources that are available. So, the ways that you can learn more through Mapletree in particular, we have a YouTube video channel that has all of these webinars that we're doing, as well as different informational things that you can assess. So you can scan that QR code there. You can follow Mapletree Education on Instagram and TikTok. Mapletree Education as a social media platform is the whole purpose behind it is to teach students and people in the field of exercise science who are considering working with the cancer population how we do what we do. So we go through different progressions, we go through different modifications depending on cancer cases and tumors that are present. We really try to teach you the ins and outs of working with a cancer population. So I think you will really find that to be a valuable resource. And if you see anything that you think of anything that we're not covering in these social media platforms, feel free to reach out to us because we are constantly evaluating our content and making sure that it's clear and relevant to the exercise professionals. Feel free to reach out to us. So, thank you so much for listening this week. I hope that you found this valuable, and please be sure to stay tuned and tune in with our next series that we'll have. Have a nice day.